Hi, everyone. Welcome back to my blog. So, this week we're going to focus on tuberculosis diagnosis. So, before we get into today's topic, let's review what we learned last week. So, we know that tuberculosis is a bacteria that spreads from person to person, usually through coughing or talking or sneezing, some type of air droplets. And it's a bacteria infection that usually affects the lungs. And if you go without treatment, it could spread to other parts of your body, like your lungs or your brain and your organs. We also talked about the difference between latent TB and active TB, known as TB disease. Latent may mean that you may have been exposed, but you don't have active tuberculosis in your body. And sometimes your physician may decide to treat you anyway. And with TB disease or active TB, that means you do have the bacteria in your body that is multiplying and causing an infection. And we'll also talk about some review of some of the signs and symptoms. And some of the risk factors include people who of certain racial ethnic groups like American Indians or Alaska Natives, Asians, Blacks or African Americans, Native Hawaiians or other Pacific Islanders, and Hispanics or Latino. So to review, here are some general TB disease symptoms. Uh, People will complain of feeling sick or feeling tired or weak. It's common to have night sweats. It's common to have weight loss when you're not trying to lose weight. And one major sign is having a cough that lasts longer than 3 weeks. And with that cough will bring chest pain and sometimes coughing up blood. So the way to find out whether or not you have tuberculosis, you would have to get tested. There are two types of tests. The Mantoux tuberculin skin test is what's pictured here, where there will be a needle going in at about a 45-degree angle right above, right under the first layer of your skin, and it'll create a bubble right under the first layer of skin, right under right along your forearm. The second test is a TB blood test, which is drawn in a lab like other lab tests, and it has to be sent off. The mantle tuberculin skin test, or TST, is pictured here. You'll see that it says if this is a two-part process. So this test would not normally be given on a Thursday or 2 days before a holiday because you're required to return within a few days. So the first part is actually going to your physician's office and getting the test placed in your forearm as pictured in the top photo. The second photo, you'll have to return within 48 to 72 hours to have it read, likely by the same professional that placed the test or another person in the office. And they'll measure it, and if it's a certain uh, diameter, it will be considered a positive test. So a positive TST test means that the body was infected with TB bacteria, and additional tests will be needed to see if it's a latent infection or if it's an active TB disease. A negative test means that the body didn't react to the test, so it's unlikely that you are infected with TB. The TB blood test is just like any normal blood test. When you go to get your labs drawn by your doctor, you're going to go to a lab, you're going to get your blood drawn, it's going to go in a tube, and it'll be sent to the lab for analysis, and you'll receive your results within a few days to a few weeks. If the test is positive, again, it means that you have been infected with the TB bacteria, and there'll need to be additional tests to determine which type of TB you have, whether it's latent TB infection or active TB disease. A negative is the same as the TST test. That means your blood didn't react to the test, and it's unlikely that you would have the infection or the disease. BCG stands for Bacillus Calmette-Guerin, known as BCG, and it's usually given to infants and small children in countries where tuberculosis is common. And receiving this vaccination does not mean that it will protect the person necessarily, it'll protect the person from getting TB. It's not widely used in the United States. However, having the BCG vaccination may create a false positive result for the TST skin test. So, what happens next, once your result comes back positive, the results will get confirmed to determine whether you have the latent TB infection or if you have the TB disease. You'll then make an appointment with your doctor who may choose to start you on medication treatment. So that's the end of this segment. During our next post, we're going to talk about more risk factors in detail, and we're going to talk about the different types of treatments that your physician may put you on, the different types of medications and what they do. And we're also going to talk about having tuberculosis with co-infections like diabetes or having HIV. So I'll see you next time.